Hello everyone, you're watching sqadia.com and I am Hamad Haider. Today our topic is nerve compression syndromes. In this we have 5 sections. Initially we'll be going the pathophysiology and the mechanism how the nerve can be injured, especially the clinical features of the peripheral nerve injury when it comes to median, ulnar and radial nerve injuries. In the second section, we will be briefly focusing on the median ulnar nerve compression as one of the most important nerve injuries which you usually commonly see in upper limb and hand. We will be briefly going through the carpal tunnel and pronator syndrome, which are the manifestation of median nerve injury in a forearm and wrist joint. Then we'll be going through the anterior interosseous nerve syndrome, which is also a part of the median nerve injury. And lastly, we'll be going through the cubital tunnel syndrome, which is part of the ulnar nerve injury, especially at the level of the elbow. In the third section, we'll be going through the radial and suprascapular nerve compression. First, the posterior interosseous nerve syndrome, which is the branch of the radial nerve and gets entrapped in the forearm and at the level of the elbow. Then we'll be briefly going through the radial tunnel syndrome. How the two fibers of the extensor carpi radialis brevis can compress the posterior interosseous nerve and lead to radial tunnel syndrome. And then we'll be also briefly discussing the differences between the radial tunnel syndrome and the Tanner's elbow. And then lastly, in this section, we're going through the suprascapular nerve compression, which is although rare, but yes, it can occur, especially secondary to some kind of tumors, ganglions, or cysts. In the fourth section, we will be going through the thoracic outlet syndrome, which is although again a very rare syndrome, but it's was one of the very common causes of the double crush syndrome. That is, even the nerve which is getting compressed lower down the carpal tunnel and the cubital tunnel is released, we can still have the pathology due to thoracic outlet syndrome. And we will be going through the management, its investigation, its diagnosis, how to manage the thoracic outlet syndrome. In the last section, we'll be briefly going through the other peripheral nerve disorders, such as especially the nerves of the lower limb, that is the lateral cutaneous nerve of the thigh, in the tarsal tunnels, and briefly we'll be touching upon the compartment syndrome, especially the neuropathy associated with the compartment syndrome. Keep watching sqadia.com. Thank you very much.